Hi there, welcome to Ask the Chiropractor, your source for health, healing, and chiropractic-related information. My name is Dr. Adam Rodnick, and I'll be your host today. I'm out of Commerce Township, Michigan, and we have two wonderful guests with us today, Dr. Ryan Cooper.
Hello.
And Dr. Gary Cholik.
Hello.
You guys could introduce yourselves and tell us a little bit about how you got into the profession and how you got where you are today.
Again, my name is Dr. Ryan Cooper. I'm out of Northville, Michigan, here in Northville. How I got into the profession, you're saying? Well, since the age of 17, I've been studying health and well-being every day of my life, and I was in personal training. I thought about getting into physical therapy, doing all types of things, and just health has always been a foundation for me. Well, it so happened my dad was seeing a chiropractor and just saw fantastic results, and he said I should go check it out. So I did, and man, from that day on, I've just been in love with it ever since. So it works out really well, and then off I went to school to Palmer Chiropractic College in Davenport, Iowa, and here I am today.
All right, I'm glad to have you with us today.
Thank you.
And Dr. Cholik?
Yes, hello. My name is Dr. Gary Cholik. I practice in Sterling Heights, Michigan. How I got into chiropractic, when I was about 9 years old, I was playing hockey, and I got taken over the boards backwards looking to pass the puck forward. Didn't see the other player coming. He took me over backwards, and I had a compression fracture. With that, I went to the medical doctor, and they put me on painkillers, muscle relaxants, anti-inflammatories. Nothing seemed to work. The only way I could breathe was bent over, doubled up constantly for about 3-4 weeks. My father was going to a chiropractor and took me there, and within about 5-7 visits, I was able to breathe again, go back to school, and continue my life. I still play hockey, and I thank chiropractic for it. Thank you.
Yes.
And that's something that we see on a regular basis. We see a lot of athletes. We take care of a lot of athletes in our offices, and a lot of sports injuries. I actually just came back last weekend from the Arnold Schwarzenegger Classic, where they had 17,000 athletes there. They had bodybuilders, they had powerlifters, martial artists, gymnasts, and most of these athletes are under chiropractic care. And we have our special conference there where Arnold Schwarzenegger comes in to talk to the chiropractors. Actually, Arnold himself is such a big advocate of chiropractic that he used to not even do one of his movies or one of his, even before his movie career, one of his bodybuilding shows without bringing his personal chiropractor there to check his spine before the show or before the movies.
Yeah, excellent, excellent. Yeah, and you think about it, and even just all the pro athletes that we have today, Tiger Woods, Jerry Rice, we just saw that video the other day, big advocate for chiropractic. A lot of the fitness people, everybody, they all have their personal chiropractors. They all seek chiropractic care because they really realize the value in it and how much it not only improves their athletic performance and their ability to recover from certain injuries, but also just with their health and well-being as well.
And also helps to prevent injuries.
Yeah,
when the spine
absolutely.
is in normal alignment, when someone is well adjusted, helps to prevent different sports injuries, different things like that. And also once they already have the injuries like compression fracture like Dr. Cholik had, this is something we see on a regular basis where bones move out of alignment, pinch on nerves, and what a chiropractor does is removes the interference from that. So I'd like to talk just a minute with you guys about what chiropractic is. We could just talk in general to our viewers here about what chiropractic is and what we do as chiropractors.
Chiropractic, to myself and a lot of other doctors, is the science, art, and philosophy of all things natural. Basically, we are a drugless and surgically-less healing art. We've been able to help a lot of conditions that the medical field have not been able to help. Basically, how chiropractic works, the brain is the master computer of the body. It tells the rest of the body what to do, when to do it, through the spinal cord. The spinal cord is housed inside the spine itself, and it does give off branches right and left bilaterally to all the different organs and the different muscles and structures of the body. Basically, structure determines function. If the structure is out of place, a person can expect bad function. When that happens, it's our job as chiropractors to gently manipulate and fine-tune the spine to put it back in place. That's with the subluxation is basically a hard bone out of place which is pinching a soft nerve. When the impingement on the soft nerve is there, it either alters or nullifies any information that the brain is sending to the rest of the spine, the rest of the body. Dr. Cooper, can you explain the different phases of subluxation?
Well, subluxation, or in a broader terms, is called vertebral subluxation complex. That's or VSC, of course. The reason why they call it a complex is because it's made up of different parts. That only makes sense. And it's kind of a complex thing. So in my office, I really provide it with a metaphor. And that is the bright light bulb concept. Okay. When you are well adjusted or have no subluxation, you're a bright light bulb. And I really believe, Dr. Rodnick, that everybody's born to be, 150 watts, pure power. But what can happen is time goes on and these components of the subluxation complex, when they take place, it starts to dim that person's light bulb. And then they dim, and then they dim, and then they dim. And then quite possibly they find themselves in a hospital under long-term care, and they're not able to necessarily cope with themselves because their body's not functioning as best it possibly can. Does that make sense? So as you'll see, as the components take place, it starts to dim the person's light bulb. Now, the big thing about the subluxation complex is, again, they call it a complex because it's made up of different components, but also it's just like any other disease process in the body. For example, the common flu. Common flu is made up of different parts, right? Nausea, vomiting, possibly some diarrhea, fever, those type of things. And those all make up the identity of the flu. Well, same thing with subluxation complex. So I'm going to go through these components with you just to show you that the subluxation is for real, of course, and it's true. And actually, the research articles that I'm going to use today are all medical research articles. We don't want to stack the deck and use all chiropractic articles, of course. So they're all medical research articles showing you, again, that subluxation is for real and that they definitely approve of our profession.
Now, along with what you're saying there with the bright light, most of the Harvard longevity studies, all the top medical research longevity studies now say that our human body should be able to live between 100 and 120 years old. And most people, especially in the United States right now, don't make it to that point. And what happens is we should be like this bright light, burning brightly up until 100, 120 years, flicker once or twice, and then go out nice and easy. But the way we see it is it just dims so early in life, and from there it's just a downward spiral, a downward cycle, because of what the subluxation is.
And as I go through the subluxation complex, again, you'll see what happens. The first component that takes place, Dr. Jan Neuro, medical researcher, what he states is that the spinal joint sprains, and what happens is it heals, but it heals wrong. And it heals in 3 different ways, either stuck, too loose, or misaligned, all right? Now, stuck joints are very obvious. This is somebody that goes to pick up a 3,000-pound bale of hay, and all of a sudden, boom, they're stuck and they can't move. Too loose, somebody they sound like a bowl of Rice Krispies walking towards you, right? The third one is misaligned. This is probably the majority of the people that walk around. They kind of walk around. They have different misalignments in their spine that, again, make up the identity of subluxation complex. And at this point is really when that person starts to dim. Now, what happens after that is Dr. Tapio Vitamin, again, medical researcher, he states that when the spinal joint sprains and it's left uncorrected, permanent irreversible scar tissue starts to layer upon the joint every 7 to 10 days, and that's really important because that's why people will say, well, why is it always my left hip, or why is it always my right hip, or something like that, because what that shows is that that's those areas that start to accumulate that scar tissue first.
And this dispels another rumor that we hear a lot of times that people have about a chiropractor is, so as these bones are misaligned, subluxated, and scar tissue is forming, unreversible scar tissue is forming over the joint consistently every 7 days, the longer that it's been there, something that's been there for 20, 30 years, for us to remove a lot of that pressure or to get the spine in a normal functional position or a normal structural position is going to take a lot more work than if it was a child who just fell over the boards at 7 years old and had a compression fracture. By the time it's been there for 40 to 50 years, that scar tissue has really built up, so it can take a long time. And so that's a big misconception that people say, don't go to the chiropractor, they want you to go for a long time. And what we do in our office is we present different options. We let people know exactly what's happening. That's why patient education is so important, that they understand the information and how the body functions, how their nervous system works, how the bright light can be shining
Yeah.
as brightly as possible.
Yeah, absolutely. And, talking about function, that's when the spinal joint sprains and the scar tissue starts to become involved. That's where Dr. Irving Kaur, again, medical researcher, he comes in and says now that the nerves become involved. And that's where we have that dysfunctional state. And what happens with the nerves is they become pinched or they become irritated. And that's a lot of the people that come in. A lot of people that come in with pinched nerves is probably a minority. Would you agree, docs?
Yes.
Usually they're either carried in or they can barely even walk in. The majority of that people that come in is irritation to the nerves. And it's just like irritation as years go on, and then all of a sudden it's like the straw that broke the camel's back. They bend over to tie their shoes, and wow, now I have a problem. So it's not necessarily them bending over and tying their shoe that was a problem. It was the years of scar tissue and degeneration that occurred before they had that problem.
With that straw that broke the camel's back, there's an analogy that I like to tell people. Use. If you take a reptile, right? A reptile is something that's cold-blooded, and you were to put it in boiling water. Now, if you were to drop the reptile, or frog, or a lizard, or snake, whatever, into the boiling water, immediately it would feel the pain, it would feel the burn, it would try to jump out. But if you were to take that frog, or that lizard, or that snake, and put it in a pot of lukewarm water, and slowly increase the temperature until it got hotter and hotter, its blood would change with it, and it wouldn't even notice as it got boiled to death. And that's what happens so frequently with people with their spines, is that something happens just so mildly that they barely can even notice the difference. And it just keeps progressing, gets worse and worse and worse, until all of a sudden, boom, the straw that broke the camel's back.
Yeah,
and now
absolutely.
they think they just now have a problem, when really the problem may have started 20, 30, 40, 50 years ago.
Absolutely. So the sooner they get checked, the better. Of course.
Exactly.
Of course. This complex keeps going on and on, though. After the nerves become involved, now the muscles become involved. Dr. Kirkcaldy Willis, again, medical researcher, he says now that the muscles start to spasm, okay? And the spasms, what they do is they feel like almost like a rope or a cable on our spine. And the spasms are designed to protect that injured joint. So just like if we sprained an ankle, for example, what happens? It tightens up and then you can't move it as well. It's a protective mechanism inborn into the body that does that. The problem, though, is that spinal muscle spasms are inflammatory. Inflammation attracts scar tissue even further, okay? And again, at this point now, this person's even starting to become more dim. Now, Dr. Alf Brigg, he says now that localized inflammation in the muscle, he says now it starts to become widespread. And what happens is this widespread inflammation starts to attract widespread scar tissue. And really what the scar tissue looks like, it looks like a third-degree burn victim. You ever seen a third-degree burn victim, docs? And it starts to layer onto the joints of the spine. And as time goes on, it can actually start to erode the bones of the spine. And that's where Dr. Lee Hadley, again, medical researcher, he comes in and says he actually documented this process of what happened if this joint was left uncorrected. We never took the pressure off the nerve to further lessen that accumulation of scar tissue on there, and it starts to erode the bones of the spine. So it can be very damaging, just like if we weren't to brush our teeth regularly, well, what would happen? Well, we start to develop cavities and our teeth begin to rot. Same thing if our spine has injuries to it as time goes on, and injury after injury, it can begin to rot, so to speak, or start to degenerate, unfortunately.
So you're saying that this last phase is a permanent phase, basically, if you let it go that far?
Absolutely.
And it becomes fused and fixated?
Yep.
Fixated?
Absolutely. As time goes on, the disc degeneration that occurs, the bony spurs that start to develop, and a lot of that structural things that happen, it is very permanent, absolutely.
And if we can get ahead of it early enough, we can increase the light bulb, increase nerve flow, but also by having proper nerve flow, we increase blood flow to the area, we increase proper nutrients getting back to the area, and can help to heal some of the scar tissue, can help to heal and prevent the bones from lipping and spurring and having degeneration when it has proper blood flow, nerve flow, lymphatic drainage, and nutrients coming in and out of the joint.
A real just thing that I do is, if we have here behind us, we see that there's different phases of degeneration that can occur on the spine. And when somebody is near normal or no injuries to the spine, man, they're a bright light bulb, and people are coming into your office, and this is more like a child, so to speak. Exactly. So what happens as these phases go on, we move on to phase 1, dims the light bulb, phase 2, phase 3, and then phase 4. And oftentimes, man, we can get these guys a lot of relief that are in phase 3 or phase 4, but we can't necessarily allow them it makes sense to me to check them when they're younger, of course, and keep them as bright as a light bulb for as possibly they can, because it's about quality of life. Absolutely.
And of course, someone comes in phase 3 or 4. Like, I have a lot of people that come in and say, I've had this problem for a long time, I have this fusion, I have severe arthritis, is it too late? It's of course not too late for us to help them. And these are sometimes what we see as quote-unquote miracle cases, where we really turn their life around, they're feeling better, their quality of life is back, they got off their medications, but will they ever be perfectly normal? No. And so, unfortunately, we didn't catch them years and years ago. Right? So saying that just like brushing your teeth to keep healthy teeth, people start doing that just when they're children. So what would you say is the youngest you would start to check someone's spine?
I would see a patient that brought in their baby that was newly born. I mean, there's many studies where a 250-pound doctor is trying to get the baby out of the birth canal, and they're twisting and pushing and pulling, trying to get the shoulder out, pulling on the neck, which is one of the most exposed areas where he can get his hands around. And that a lot of times, when the baby's spine that young is like made out of plastic, it's not hard yet, the doctor can do irreversible damage. And I've seen babies very early, like 3 days old, 4 days old.
So what you're saying is the first time in life that a baby could have damage to their spine or subluxation is right from the birth process.
Definitely.
And that's why, myself, I also check lots of infants, lots of babies in the office. And a lot of times we see them that already have damage, and some of this damage has even led to things like cerebral palsy or failure to thrive syndrome in babies and in infants. I took care of a child who had something that they call Krabbe's leukodystrophy. And this likely came somewhat from the birth process or various things that the baby did near the beginning of life. And this was a baby that they said was only supposed to live for about 2 or 3 months. And since I've been taking care of the baby has lived almost a year. And so pretty amazing that.
Absolutely.
That's a miracle in itself.
Yeah.
So we have a video clip actually that will kind of elaborate to us right now on the birth process, how it can be traumatic to a baby's spine, and how we want to make sure to keep a healthy spine from that point on. So if we could just roll that video clip, we'll be back in just a minute.
Here I am, natural childbirth.
This birth is an example of a so-called natural birth happening every day in our modern society. What could be a natural process has been turned into a technological procedure, leading to interventions with lifelong consequences. Unable to feel what is happening, the mother becomes disconnected with the process and is not capable of adequately participating in her labor.
Baby, okay? Push.
Okay, honey, a little bit.
Push.
Little
No,
bit.
you don't have to. If you want to. I can do the work
He's
for you
got
here.
strength.
There comes one shoulder.
This leads to the use of extreme force. It is this force from pulling and rocking on the baby's fragile neck which causes undue trauma to its delicate spine and nervous system. One expert medical researcher on spinal cord and brainstem injury tells us that the birth process, even under optimal, controlled conditions, is a traumatic, potentially crippling event for the fetus. During birth, delicate nerves are traumatized and stretched. The spinal cord is twisted and torqued. Cranial bones are squeezed and jammed. Most children experiencing birth in our society have been subjected.
And so to most people, the birth process is just a normal time in everyone's life. But when we see a video like that, we can see how traumatic. We know it's very traumatic for the mothers, obviously. But very traumatic for the baby. And you can see there that they use the hands, and when a woman's laying on her back, it's not optimal position for her to contract the abdomen properly. So what we have to do, the doctor grabs, pulls and twists on the baby's head and neck. And when they pull and twist, these bones, like you said, are just like plastic. They're cartilage. They're not fully formed into hard bone yet. Can easily misalign, put pressure on the cervical portion of the spinal cord, the nervous system, or even worse, the brainstem. And so we see that a lot. And one thing, we can see different symptoms, infantile colic, like I said, cerebral palsy, some different things right from that. And that makes it easy for the mother or the baby to notice that there's a problem and that we can do something about it, and that's when we can check them. But a lot of times, this happens without symptoms, without any evidence that the baby has a problem. And so the only way to know is to actually check, and that's why we check so many infants right now for nerve interference in our office.
Dr. Abraham Taubin, he actually, again, medical researcher, he actually did a lot of wonderful research for the chiropractic profession. And what he did is he talked a lot about this actual birth process that we just showed and how really it can be an injury to our spine and nerve system. It's birth injury of this nature, quote unquote. Sometimes it's extensive and it's often latent, meaning that it goes undetected and people don't really realize that there was a possible injury there. It's undiagnosed clinically and pathologically. So, and then Dr. Taubin actually, he did some more research, and he did his research on children that died of SIDS, unfortunately. And SIDS is obviously diagnosed after the fact. But what he did is he did autopsies on 8 children that died of SIDS, and that he found that out of 7 out of the 8 children that died, they all had spinal injury with nerve damage. And we can't ever say that potentially, you know, the birth process was a cause of why that child died of SIDS, obviously, but there is some correlation there to that. And I've just recently read something on, they studied rats and SIDS, and they found that serotonin, a neurotransmitter in the brainstem, is a very large regulator of heart and lung rhythm and rate and all that good stuff. And they found that the rats that had decreased serotonin, they were more likely to die of SIDS, rat SIDS. And so that goes to show that the neurotransmitter serotonin plays a big role in that. Now also, we do know that subluxation can interfere with the body's ability to produce serotonin effectively. So there's some hand in hand there, and of course we can't ever say that no matter what, if the child is checked, that it won't die of SIDS. But there's some strong evidence that shows that children that are checked from birth more than likely don't die of SIDS.
Very huge correlation there.
Right,
and
right,
we've seen
right.
in the last 50 years that the percentage of children that have SIDS is definitely increased.
Yes.
That's why we've been checking so many more infants within the last few years. There was another study, and I don't know if you brought this study, doctor, but it showed it takes 120. It was a study that was done on stillborn babies. Right? You familiar with it?
Oh, yeah.
And it shows it takes, I believe it's 120 pounds of pressure pulling the baby's head out that would actually decapitate the stillborn baby when the baby came out. And it showed 80 pounds of pressure would decerebrate, where it's not going to actually show any physical signs on the outside, but it's going to change the structure and the function of the spinal cord itself for 80 pounds of pressure. And they're showing now that the average force coming out is something around
90 to 120.
90 to 120 pounds of pressure to pull the baby's head out. So that's showing that there's a very likely chance now that infants and babies will have some damage in the spinal cord during the birth process.
Yeah, and studies show time and time again, Dr. Gottfried Gutmann, a German researcher, he found that in his study of 2,000 children that actually 80% of those children were out of autonomic balance in the first bone in the neck. Autonomic balance meaning that they have nerve system pressure in the first bone in the neck. Dr. David Yoshon, he came in and said that actually 10% of children actually die from the delivery process. And here in the state of Michigan, it's about 7.9%. So it's a very traumatic event that occur. And that's why it's, whether the child has symptoms, doesn't have symptoms, definitely needs to be checked for spinal injury.
And actually, in this country, the rate of infant mortality rate is actually the highest of any other country in the industrial world. In most countries, out of 1,000 babies, somewhere around 2 will die. In this country, it's close to 8.
Yeah, so.
The scary thing about what you're talking about is even though some of these children that have been pulled out at 90 to 120 pounds don't have symptoms right then and there, it will accumulate and show up later in life,
Oh,
whether
absolutely.
they're in school, whether they're in sports, wherever. But
Yeah.
they just can't cope as well as other kids.
You know, it's funny, he just mentioned that too, is that later on in life, what's the percentage of people that suffer from a neck or back complaint? Isn't it close to 80%? And I just thought of that, and then the research shows about 80% of children are actually injured from the birth process, and correlates pretty well with, 80% of adults having a neck or back complaint of some sort. So.
And they're even saying somewhere around 40 to 50% of even children by the time they're 18 have had at least a dozen times where they've complained of neck or back pain.
Oh, goodness.
And this happens. And this is just, we're just talking about one instance here, the birth process, let alone all the bumps, bruises, falls, hockey injuries that they've had as they're growing up. But now, as we're talking about the birth process here and that this damage can happen to the nervous system, I want to talk for just for a minute or two here about what it's like taking care of or giving a chiropractic adjustment to an infant, because many people are very scared or see that the big cracking sounds and that a chiropractic adjustment may be painful or that it may hurt their child. So how gentle is it, Doc, when we actually adjust an infant?
In our office, we never force anything. You know, we basically use chiropractic more or less like, say, judo, where we use the patient's weight and balance against them. And with proper stretching before they actually get adjusted in that, we loosen them up real good. It's not traumatic at all.
A good analogy would be, too, is testing the ripeness of a tomato, especially in an infant, you know, where they do have the cartilaginous bones and it hasn't quite ossified yet, but testing the ripeness of a tomato, just a little bit of pressure sometimes can often correct the subluxation in a young infant. When children get a little bit older, you know, you do have to not necessarily use a specific force, not to use that word, but when you do go in there and adjust a child, it's definitely not like an adult that's accumulated all that scar tissue over time. So, yeah, it's a very gentle process.
It's very gentle. It's very easy. You know, a lot of parents are scared to have their children checked because they think it may hurt the child. But it almost, when we're doing an infant, almost looks like nothing is even being done.
Yeah.
Use the thumbs, use the fingertips, just very, very gently. And sometimes we'll even use instruments. We have things like an activator, which is a very light force tool that a chiropractor will use to make adjustments and use these things on infants.
If I can just backtrack just a slight bit, we were talking about kids having slips and falls off the monkey bars in sports, the way they slouch all the time, playing their video games or studying, watching TV, things like this. A lot of parents just brush it off, their injuries and that, as growing pains, or they just
no blood,
they
no
just
foul.
hurt. Yeah, exactly. And they don't bring the kids in, and that's a scary thing because all of this trauma accumulates with the scar tissue, with the adhesions, with abnormal motion. And if you break your leg, like I said previously, structure determines function. If you break your leg, you're not going to walk very well. You're not going to put the weight that you should on your leg. What happens after that? Your posture and your gait is off. What happens after that? It travels right up from the foundation on up, the spine, all the way to the neck and the occiput and that. You start having other symptoms that you don't relate a headache to a broken leg in the way you're walking. Kids are the same way. They don't realize this and they don't get checked early enough. The parents blow it off thinking that, well, they're going to get over it. They'll heal. Let them keep going.
So what we'll do, we're going to talk about this correlation a lot more next week. And we'll talk a little bit more about the different ways that a child can be subluxated. I know we've talked a lot today about the birth process and why it's important to get infants checked, but we'll definitely get into as children age a little bit next week. But we are just about out of time. I really want to thank you, doctors, for joining us today.
Absolutely.
And my name is Dr. Adam Rodnick out of Commerce Township, and you've been watching Ask the Chiropractor. Remember that God gave us the gift of life, and what we do with that gift is our gift back to God. We'll see you next week.